Great. This is so exciting. I'm so excited to be here. It's an honor. I was really glad to meet Brent and some of the other execs over at the AOASM convention in Philly. And it's so neat to see the campus and how it's grown, reminisce with a lot of the faculty and staff that were here when I was a student. And you really, really have a great academic setting here. So wonderful, and it's so neat to see. So thank you to Brent and the sports medicine team here, Dr. Phelps for helping, President Phelps now, for helping to bring me here, and I'm very excited. So I'm just going to show you a little bit of some of the things I do and some of the journey that I've been on to get to be family medicine and sports medicine physician. And then I definitely want to open it up for any questions that you may have or things you want to bring up about the profession. So this is my Nike Women's Marathon team. And I like to open with this because I really like the quote here. I'm a member of a team and I rely on the team. I defer to it and sacrifice for it because the team, not the individual, is the ultimate champion. And that was said by Mia Hamm. Truly, whenever you're on site at the event, it's working with everybody. Everybody plays a key part in helping the athlete or helping the event be the best it can be. So what is a sports medicine physician? You probably know this guy here next to him. Physician with significant specialized training in both the treatment and prevention of illness and injury. We're considered as sports medicine physicians to be a subspecialist. We help to maximize function, minimize disability, and time away from work, school, or even the office, sports for these athletes. Sports medicine physicians, leaders in the medicine team. It includes the specialty physicians, surgeons, athletic trainers, physical therapists, coaches, of course the athlete, and parents. And no one better defines this as Dr. Phelps. Sports medicine track. So we talked a little bit about this last night. There's a couple ways you can get there to be a sports medicine physician. You can choose primary care, and that might be in ER, pediatrics, internal medicine, PM&R, and of course family medicine. And then second would be the orthopedic surgery route. Most primary care sports medicine physicians choose family medicine as their foundation to move into the fellowship. Of course, that's 3 years of family medicine residency, and then usually the fellowship is about 1 to 2 years, depending on which fellowship program you go through, either with the AOASM or the AMSSM. Of course, the orthopedic surgery route, you'll go through the residency program with them and then go into the fellowship afterwards. So educational training. This is where you probably need your notes to take down. Couple things in residency. You're in there, to really practice what you learned here in school and look at the patients and spend some time with them. It's also a time after your internship year to kind of focus in on, is the fellowship going to be for me? So usually during the second or third year of residency, you might start working with a local team on local events and sports physicals. Maybe you're going to incorporate a rotation, sports medicine rotation, into your elective during that time. And then usually during your third year of residency, that's where you'll go forth and apply for the fellowship. We like a resident to come in and do a 1 to 2 week rotation so that we can get to know you. We get to see if you're a good fit for the program or we're a good fit for you. And anything less than a couple weeks or even a week is hard to kind of gauge if it's going to be a good fit. I bring up these couple pictures because in residency, I got asked to help out with the AVP Pro Beach Volleyball Tournament in Phoenix, Arizona. and it was a chiropractor that was actually one of the head team doctors. And so I had talked with him, and he came down on the first day of the event, and I'm really excited. I'm like, wow, this is gonna be so great. And he says, okay, here's all what we do, and here's how it's set up. And you'll be working with these different people here. Here's some of the athletes that are gonna be here. Of course, there's gonna be lots of manipulation going on, because volleyball players really like that. And everything good? I was like, yeah, good. And he's like, here's my cell phone number, and if you need anything, let me know. And then he left. So I never saw him for the whole entire tournament over the weekend. And I was like, whoa, I'm running this. Like, this is crazy, you know? And this is during residency time. But super good hands-on experience. And, you know, with your osteopathic manipulative skills, it was a total good fit. So working with these athletes. During your residency, definitely volunteer for some local races or events going on. And as you're doing right now, you're involved within the sports medicine club, and that's excellent because you're going to have great resources and people to ask questions. Of course, you have the best person in the house, President Phelps, who's always lending his information to you. Conventions. Conventions are great too. As Brent talked about, we met at the AOASM. Those are some of the great places to meet some key physicians. As a fellow in sports medicine, when I trained, I was able to go to both conventions, the AOASM and the AMSSM. I think that the AOASM definitely was a lot more of my kind of environment, where it was a smaller crowd and it was very personable. Everybody, you know, talked with each other, and we got to hang out, and everybody was so helpful. You got a lot of one-on-one time to, you know, talk about programs. There was OMT sessions, and from that day on, I had been going to the AOASM conventions. Really great networking and resources that, you know, can help you in your future. During the fellowship program, you know, for the primary care doctors, there's a lot of time learning about sports medicine injuries. We do, in our program at San Diego Sports Medicine, up to 6 months of orthopedic surgery where you're first assist. As you graduate the fellowship, you do have those privileges at the hospital if you want to go forth and be first assist with the orthopedic surgeon. Some doctors do that. I chose not to because I love the clinic too much, but appreciate the surgery experience so that we know how to prep our patients that might need their services. And definitely serving as a team doctor for local high school, college, professional or elite teams, really gaining experience in the training room and also in the field, on the field. And so at the bottom picture, that's Carrie Walsh on the right, and Misty May is on the far left. I'm not too sure who the other girl is. So can you be certified in sports medicine? The answer is yes. You get a CAQ, Certificate of Added Qualification in Sports Medicine. It's a written exam, and it covers the medical and musculoskeletal aspects of sports medicine. You'll also get some osteopathic medicine questions too, which is great. And in the future, we are looking to combine a physical exam portion along with a OMT portion for the CAQ certification. 2 organizations certify the physicians, the ABMS and the AOA Bureau of Osteopathic Specialists. And since 1999, you definitely need a fellowship training in order to take the test. So why osteopathic medicine? Well, as primary care, you get a great foundation in general medicine and OMT. You being at the school, you have and you're learning mad skills. For OMT, you bringing that out into sports medicine, for the musculoskeletal exam, it's amazing what you bring to the table. And you learn that with each athlete and with each team that you get to work with, that you have learned something great here at KCOM. As a primary care sports medicine physician, you don't lose track of your baseline training. You're always implementing that because the athlete needs, care for their cough and their cold or their sinus infection in order to travel the next day to whatever state to play for the team. Or they're leaving in, 2 days' time out of the country to go compete. So there's always things that come up, asthma, hypertension, diabetes, despite the musculoskeletal injuries or strains that the athletes may have. We make, as DOs, overall excellent physicians for all patients and especially the athletic population. The bottom is my husband's rugby team, the NAU Land Sharks, and now he's on like the old dinosaur team because he's been graduated and he still wants to play despite tearing his ACL. But whenever we are at a game, I don't get to just watch the game. I'm their team doctor, so I'm always like sewing people up on the sidelines and treating all kinds of injuries, so that's kind of fun. And Chargers cheerleader, the center woman, her and I grew up together dancing, and she was the captain back in 2012. So that was pretty neat. I told my dad I would give him a shout out, so I put his picture up top, him golfing there. He's staying active, fighting the fight, anti-aging, he's doing good, keeping active, still running. So a couple of questions is, can a regular family doctor or a regular orthopedic treat a sports injury? The answer is yes. No fellowship is needed. If you decided to go into the primary care tract and you still wanted to, do and treat knee injury or shoulder injury, you still could do that. But know that the extra training really goes above and beyond, and it's amazing the detail and how much you get to kind of finesse your exam and your skills with the fellowship and how much more that you bring to your patient. So I definitely encourage the fellowship because it makes a huge difference. And going back and giving a few different lectures for the family practice physicians in various capacities, it's pretty amazing to see what the fellowship teaches you. And as you come back and you're teaching others, other physicians, on how much you know from doing the training. So should the patient see first a primary care sports medicine doctor or an orthopedic sports medicine doctor when they have an injury? There's definitely some cases that will come up that are absolutely surgery, like you're like, no, you need to go straight to the ER or you need to go straight to see the orthopedic surgeon. So that will always be there. But most sports injuries can be commonly treated by the primary care sports medicine doctor. You're at the forefront of seeing these injuries and diagnosing and determining, is this a surgical case? Do I have to call up the orthopedic surgeon who's on my speed dial or send him straight to the ER? So you're at the events and you're at the sidelines and making those calls, working with a team to do the best care for the athlete. Even if the injury will require surgery, you're their best referral. You're going to help to place them with the right person in order for them to get further care. With all the orthopedic surgeons in San Diego, we have their numbers literally on speed dial, and we're sending them x-rays and different MRIs and writing out a little case presentation to say, hey, do you think this person should come in, or are we okay to let them do this for casting and all that, and they're great to get right back to us. So you'll really get to learn your local community and work with them. It's all a team approach. This is the X Games. So I think this was in 2013. And so Sean White's up at the top right. He actually started with skateboarding and then moved into his snowboarding. So that's neat. And then the bottom is one of the women skaters from Brazil who's doing really well. And this is the San Diego Surge Pro Women's Football team on the top, and you can see some of them on the bottom there. And at first when I got the call, it was a year after fellowship, and the group said, "Oh, Becca, we wanted to see if you wanted to cover women's football." And I'm like, "You guys, like, no, I'm like lingerie, powder puff football. Like, you got to be kidding me, you know? Like, I'm not going to do it." Everyone's like, "We'll help you cover. We'll help you cover," you know? But I said, "No, I'm not going to do that." So then the second call came like a few months later, and they said, "Becca, again, like, there's a different team, but they're calling to see if you can help out." And I said, "No, my answer is still no. Like, I'm not going to go and help out with that. Like, I think there's some other things I can do." Sure enough, this team was legit. Like, these are all these women were like past athletes in college and all these different sports, and it's full pads, full contact, and their team's amazing. And so I was able to work with them, and they traveled to Chicago and won the 2012 national champion. So it was like women's Super Bowl. So it was pretty cool. So I'm glad I took a chance and didn't think that they were just lingerie football. Once you see them, you're like, whoa, like, okay, these ladies are legit. They're playing up. So that's good. So anyways, great team. Most orthopedic surgeons are more than happy to like get assistance in managing the cases. They want to do surgery. And so like if there's, non-operative cases, sports medicine injuries, things that can, be helped with, injections or OMT or physical therapy, this is for you. This is where you come in. This is the fun of it. And then if, something doesn't go in the right path, you can send them over to them. There's a lot of times that patients will go to the ER and they're told, follow up with your primary care doctor, but also here's a referral to an orthopedic surgeon for your back pain. Here's ortho spine. And you're like, what? This person doesn't even need surgery. Like it's not like there's cauda equina syndrome or any type of like, lumbar radiculopathy, anything like that. These are patients that you can help, and you're like, listen, I got this. Like, I can help you with this, and here's the different things going on. Okay, do I still need to see the surgeon? I'm like, no, you don't need to see the surgeon. So there's a lot of ER doctors that will just say, oh, okay, your knee hurts, you need to see an orthopedic surgeon. Like, nothing surgically is wrong, your x-ray's clear, but like, go see the surgeon. So this is where, help building like a good rapport with your patients and, really having that good communication that you can let them know, here's all the mad skills that I can offer. The fellowship, 1 year of your life. Literally, it's like so many hours are spent learning, but it's all worth it. It definitely takes hard work, dedication, passion for the sports and the athletes, long hours. You're in the OR, like I was saying, about 6 months, back and forth in the clinic, the training room, events. It's definitely time away from family and friends, but you're out there living it. You're getting your practice, you're, doing OMT in the training room, diagnosing, finessing your physical exam skills. You're reading a ton, and you're learning to work with a lot of different teams on so many levels. The bottom, we as family physicians, we take care from like babies to grannies, and so they end up having a kids camp every year in San Diego. It's the Reggie Bush and Philip Rivers kids camp for football, and so we got to be the medical staff during that time, so it was fun working with all the kids. Luckily, nobody got hurt at that camp. And then the above picture, again, there's so many opportunities that come up, and during the fellowship, one of my first events was the USA Women's Water Polo Tournament. And I said, I don't even know about that sport. Growing up in Arizona, like, not really anybody played water polo, And so, anyways, there I was in the book, Sports Medicine Secrets, all like doing all my reading, trying to figure out the game, knowing about like common injuries going on. And of course, when I got there, the athletic trainers and everybody was, a big help in helping me to learn the game and kind of watch for certain things during the game, certain injuries that could happen. So it was great, but you know, a lot of the things you're learning and you're kind of experiencing for the first time. Same kind of thing with like running a Saturday clinic during fellowship. You know, one of our like professional triathletes came in with a stingray bite, and I'm like, what do you do for that? I didn't grow up with stingrays in Arizona, so I don't know. I really don't go into the ocean. And so there I'm calling one of the team docs. I'm like, hey, listen, so one of your patients just came in, stingray bite, like what the heck do I do for that? So he goes over and okay, I got this. So, you know, I go in, I was like, all right, here's what we're gonna do. I'm gonna make sure, like, you know, keeping the situation calm. Meanwhile, she's like in pain, like super burning pain. And then I got one like 2 years later, and so now I know what it feels like. The fellowship, you know, basically, if you have a passion, one specific sport or one certain thing that you want to get from that fellowship training, definitely look at programs that are going to help you with that strength that you have and that passion that you have. Look for programs that are continue to give you opportunities for you to achieve your dream. This may be the place you work for the next 30 years. You may love it, every single minute of it. And so you want to be in a place that you're going to be able to do the things that you really like to do. So this is one of our, in the bottom, one of our head team physicians for San Diego State and the Olympic Training Center, Dr. Alan Richburg. And then you have physical therapist director up top. The fellowship training at SDSM, where I went, is 1 year fellowship training. It's dually accredited by the AMA and the AOA. We work closely with the UCSD program. So they have, I think, 2 fellows that they choose per year, and so you'll see how we kind of work together. I think our fellowship is the best of the best for hands-on experience. There's so many events and so many opportunities you get to use your skills, physical exam, OMT, in every aspect. And the location is great too, because most of the time you're outside. And if you cover some beach sports, that's fun too. You're in family medicine clinic. So it is encouraged and it is definitely important to be a great family physician in order to be a good subspecialist in sports medicine. You need that foundation. So you're in there 4 half days per week, running a family medicine and sports medicine clinic. We have 2 locations. You're at SDSU all the time. Pack your bags. You're gonna be living there. You're there like every day. It's maybe only for a few hours, but when it's football season and basketball season, you are there all the time, and it's a ton of fun. Not only you're at the games, on the sideline or on the court, but you're also the next day helping to run post-injury clinic, and that's huge because you get to really see these athletes and help them and be in, they're part of the continuity of care. So it's really neat. Olympic Training Center, you're there about 2 to 3 times per month. Rotations, you're doing about 3 days per week with electives too. It's amazing what you can bring for your electives. I wanted to do a lot of focus on dance medicine, and so I ended up proposing that I wanted to train for 2 weeks at NYU at the Harkness Center for Dance Injuries, and I was able to go there. So that was a lot of fun, great learning, and I even was able to go to England for 12 days to learn through the International Association of Dance Medicine and Science and attend their convention as well. So there was a lot of great flexibility within the program so that you can kind of put in what things that you like to do. We have a peak performance center where we actually help with professional bike fittings, and we get to do the VO2 max fitness testing for athletes. We have a personal training group that is with the physical therapy location, and they're able to go through and help the athletes like move to their next level of training along with the coaches that they have as well. And of course, there's lots of event coverage. The cheerleaders on top, you'd be amazed. I probably am seeing like equal concussions from them as I am in the football players right now. And so don't forget about them. If you're on the sidelines, like you're gonna be focusing on the game, but they're gonna be behind you doing flips and stunts and things like that. The bottom two is from X Games, and they even had some people in the wheelchairs, like Paralympic X Games, and they were pretty rad. They were doing all kinds of like jumps and things, and you're like, am I gonna have to go out there like if they fall out of the wheelchair or anything like that? But they're legit. I mean, they're out there and they're doing their thing. So yeah, it's pretty fun. With the San Diego Sports Medicine Fellowship, you are the medical director for the Thunderboat races, and things can get crazy. You think like, oh, I just do the physicals and then like send them out on their way to the boats, and you kind of just watch the boats go, but like boats flip. And this year, our two fellows dealt with that, where it was going really fast, lost its balance, and ended up flipping in the air, and then it came crashing down. But it has this little capsule inside, so it like ejected them, you know. And so, anyways, they're in this like cool Batmobile capsule, and they were safe. Like everyone was okay. But things happen. So, and the video's on YouTube. Breast Cancer 3-Day Walk, your assistant medical director. And this, every year, it's like a different theme. This past year, up top you see the picture, that was like the survivors from that show, like that used to be on. It was a reality TV show stop, so all these people were up there and got to visit with the walkers, and everyone was so excited. BMX World Cup and the World Games at Olympic Training Center. That's actually coming up this weekend, so myself and a couple other physicians will be working the BMX World Cup games here on Friday, Saturday, Sunday. High school football team, that is a lot of fun. That's where you're gonna get a lot of the teamwork approach, working with the athletic trainer. Your phone will be blowing up with text messages because all the athletes, you know, come to the athletic trainer, and then if they have questions, they're texting you, and you're trying to coordinate care. And so it's a lot of fun. You really get to work together as a team to help the athletes out. There's moonlighting opportunities with Saturday Clinic, and basically the ability to shape your own program according to your passions. This all was like aligned perfectly when I saw it last night. The didactics is every Tuesday from 2 to 5, and that's where you get to work with the Navy fellows and also the UCSD fellows, and everybody gets together and learns and goes through lectures and journal club during that time. The last Tuesday of the month, which was always my favorite, was the educational day. So together, we were able to experience all these new sports to learn and to like be able to do them as we treat the athletes that participate in them. So that was kind of neat. The musculoskeletal ultrasound course, huge. When I saw your guys' lab, it was, I mean, like I'm blown away how amazing, how advanced, and what awesome skills that you have and will gain by using the ultrasound. Right now, a lot of the physicians are paying for courses to take to learn how to use it in these different settings. And our fellowship program is working with UCSD. We actually have the like pretty fresh cadavers that come in, and so they have a session and they'll go through an ultrasound on them. Of course, use a separate one to ultrasound on each other, but you know, practicing for injections and things like that. So that's one of the new things we've had over the last few years. That's fun. And then, of course, attending a sports medicine conference, one per year. We'd like you to be, you know, doing some research to look at case studies, maybe putting that into a poster or a podium presentation. That way you get that also academic experience at the conferences. And then our center is unique because we have acupuncture there. We also have physical therapy and, of course, our peak performance. So you work with all these people to help design some really great programs for the athletes. You might be in clinic and you might have somebody from WWE that comes in, Rey Mysterio, we won't say his real name, that comes in and visits you and needs treatment before they leave to Mexico. Or you might be sitting, ringside at the MMA fights where you get to come home with like blood droplets on your glasses or forehead and no one lets you know. But it's all fun because you get to do all kinds of great things and work with the athletes. That was a little shock. I came home, I'm like, what? Nobody told me. This is so gross. But anyways, that's what happens. And so you stay back and wear your glasses. If anybody covers MMA, bring your glasses. The Sports Medicine Fellowship, long days, 10 to 14-hour days. Definitely lots of energy drinks, probably to keep you on your toes and stay sharp. Working with the team and learning how everybody plays a part in helping the athlete be at their best is the most fun. Getting to know, the community and work with them and have that communication, it's really neat to see the dynamics of the teamwork. You're going to be doing a lot of reading, but despite all this studying, despite being there, you have to take care of yourself too. Definitely keep up your exercise and take that time. I know now too, with classes, it's hard, and at first I felt guilty taking an hour off to go and work out, but then I realized how important it was. And Dan Martin does a great job of implementing a wellness program, and I know it's evolved since I went here to school. And so take advantage of it because it's important. You got to take care of yourself through all the education you're getting. During the fellowship, towards the end, it kind of gets real. So it's like, I got to go and find a job. And you got to think about, with your experiences, what kind of sports coverage do you want to cover? Is it high school, collegiate, professional, Olympic? There's a lot of choices. Know the local doctors in the area. Sports medicine, if you talk to some of the team physicians, they've been there for like 20 years. So they have a lot of experience and they have a lot of great advice to talk to you about how you transition and maybe helping with that sport as well. And you have to choose what's going to be the best fit for you. You can decide on private practice. Is it going to be a small group? Maybe it's going to have a little bit more collegiality. Staff is smaller, a flexible schedule. Maybe you're going to have a better relationship with some of the specialists around the area. The salary and the benefits, they'll be okay. They might be, a little bit better in other places. Or there's the hospital-based practice, where the hospital owns the office, off campus of the hospital, which is a huge group, multiple sites, maybe less collegiality, a large staff, a very regimented type schedule. And maybe there's so many physicians in the hospital network, you might not get to know them too well to know who really is best for referrals. But their salary and benefits may be better. This is a good picture of BMX World Cup, the top two. Literally, you are like packed with all kinds of gear and walkie-talkie, and you have your sideline bag, and you're standing in the middle of the race course. This year is going to be on the replica of the Beijing Olympics track, and this is only their third year. BMX is only their third year in the Olympics. But this will be, you're standing in the center, and then literally like right to the wall is where the track is. So you're just like, ooh, please don't fall, please don't fall. And it's really neat, and then there's like the bright lights, and so it gets kind of crazy. Usually the team docs get to set up where there's going to be most likely where an injury pretty, catastrophic could happen. And so it gets a little crazy. High school, it's fun, it helps your community, and the community helps to build your practice. So if you're out there and you're, volunteering some time within reason, These are going to be the kids that you might see for years, and their families might come in. There's a lot of building of lifetime athlete relationships. As a high school team doc, I've seen already now the high school students go through, and a couple of them graduate and go and play football at other schools, and they come back for a homecoming game, or they still will call in with questions for me, oh, I hurt my MCL in the game, and here's what the athletic trainer wants to do. Is this still okay? Is this still am I getting good advice? And so that's kind of neat, because you build that relationship with them, and that continues to carry on. So it's a lot of fun. Collegiate, you'll have to think about community college, Division I, D2, D3, universities. Each one runs a little bit differently. With each level, you're going to have to learn about the different protocols, with NCAA, the guidelines, and definitely comes in cost-effective medicine. All the schools have a budget, so you may want to provide a prescription for Advair, which is super expensive for asthma, and that's going to cost the school a lot of money to get that medicine. So you kind of have to weigh the risks and the benefits, the pros and the cons, to see, will this be the best medicine for the athlete, but also cost effective for the university. So there's a lot of different factors that will come into your decision making. Definitely sideline and travel experience, and then dealing with the media could be minor to moderate, so you start to learn a little bit about the do's and don'ts with media. This is a great opportunity to be involved with the community college and university, because in the future you may want to think about being a medical director or the head team physician for that university. At state, we're pretty proud of Kawhi Leonard, who has been a stud and moved on to the San Antonio Spurs and got MVP, so that's pretty neat. Team coverage, professional. What organization? NBA? Do you like MLB, NHL? Maybe it's celebrities, okay? Maybe you're the doctor for the concerts that go through, and you get to treat the celebrity and the dancers and their stage crew when there's anything going on. Definitely sideline and lots of travel experience. Dealing with the media is pretty major. And then I've got, of course, lots of guidelines and rules, but you're working closely with the team. Now the Olympics. So Team USA, how do you become an Olympic doctor? Definitely you need your fellowship in sports medicine. Being at least 5 years of practice before you can work at the Olympic Training Center. I have a little bit of a different story that I'll let you know, because I'm only in 5 years of practice, but I'm also now 6 years at the Olympic Training Center as a fellowship. Credentials and MAD skills. You're learning your MAD skills here. 2-week internship at the Olympic Training Center. That could be in Chula Vista, or that can be in Colorado Springs. That 2-week internship, you take that time and you actually pay for yourself to go over there and spend time to work with the team, work with Team USA, different events going on, so that you can kind of do your audition and see if this is going to be a good fit for you and maybe a specific team. Every single person that you meet in that process is key to really seeing if it's going to be a good fit for them to entrust the care of the athlete to you. There's a waiting list, so even though you do the internship, there's some physicians that wait their entire life to be called to go to the Olympics. There's others that get picked up in a few months. So it's not always a guarantee, but it's a hope. And it's definitely, with talking with the right people, going to convention and really, learning from others, it's nice to be able to get their advice and maybe even get their help in working with a team. When you do your internship, then you're on that waiting list, and then you can possibly get selected to help with Team USA. So you might travel for a few things here and there. But in order to go into work at one of the Olympics, Rio coming up in 2016, a physician has to complete and be a part of the Pan American Games and also help with the Paralympic Games. Even after that, you might not be asked to go to the Olympics, but you're hoping that by that time you've really been able to work and show that you are there to help the athlete and lend your expertise to keep the athlete healthy and safe. Then you could be asked to the Olympics. Cool thing is with USA Beach Volleyball, other than working on physical exam and then learning about the common injuries, you're working with a ton of people. There was everybody there, from chiropractors to athletic trainers, physical therapists, orthopedic surgeons, and everyone's doing kinesiotaping. I mean, you get to learn new skills, and with that, it's all in the help, to try and keep the athlete at their best. This is the Olympic Training Center in Colorado Springs. I was able to go there a couple times, and one with the AOASM. So just a few pictures, just showing that there's gymnastics on the top right, and then on the far right, there's that's where they have wrestling. At the bottom, that's the pool where Michael Phelps did a bunch of his training and time trials. And what's pretty neat too is that they have the Olympians in training that are actually leading the different tours, so you get to talk with them about their experience. So I just brought this quote here because I thought it was pretty neat. This guy is a painter over in Greece, and he came up with this for the Olympics and has a lot of his artwork that are up in the Olympic Training Center. So praxis means not only to try, but also to penetrate, to fight, to give in, to win, to lose, to kneel down, to get up, and to accept the struggle and fight until the last breath. I thought that was pretty cool. So praxis, you guys are going through praxis right now with all your testing. But yeah, so this was really neat. And with London, I got to work with the women's USA field hockey team all up until London, just at their games and tournaments that they had there in San Diego. But I didn't get to go to the London Olympics, so maybe next time. So what do? These are my teams, and kind of looks like I don't have a life besides going to sports events. I do, but it's a lot of fun. I enjoy the sports, I enjoy working with the teams, and I felt like, I wanted to go and experience all these different sports and see what it was like and gain the training and learn about the common injuries. Everything from a Olympic to a university to, the Symphony, the San Diego Symphony, the rugby players, the San Diego Derby dolls. They're fairly new, kind of up and coming. Those roller derby girls are pretty crazy when they're on that track. I mean, they're like elbowing and as they're skating by and punching each other. They fall. Almost everybody has their PCL that's ruptured. So it's pretty amazing when you do the exam. We're like, oh, my knee hurts. And I was like, oh, okay, let me check it out. And then you're like, whoa, that's good. PCL, oh, that's been gone for years. And then they're just still playing, Yeah, they're like, oh, okay, good. MMA, that was a period of time where I got to cover some of those. And probably the best traumatic sports injuries that you could ask for, relocating shoulders and ankles and elbows, and so it was a lot of fun. That was some good times. And I did put the Lady Gaga picture for a reason. I was able to cover the Art Pop tour that came through San Diego. So that was kind of neat, and also help with the Backstreet Boys, so that was fun. So yeah, there's some really neat things that you never think that you can get into that really come up, and you're able to offer the expertise and work with their team. And this past year, I also started a foundation called the Latina Strong Foundation to help promote healthy diet and exercise within the Hispanic community. So you'll get to hear a little bit about that tomorrow if you come. Getting involved. The AOASM has been amazing. I started to learn about it with Dr. Phelps. And since then, attending conventions and talking with a lot of people. KCOM is amazing. You guys have such great education, and you should be proud and know what kind of awesome, faculty and different physicians are out there practicing, all from this school. Dr. Bytomsky, I think he came last year. He's in the center, is with Duke. Dr. Parker's to the right of him, right in back of myself, and he's our program director at San Diego Sports Medicine. Also, Dr. Phelps' lab partner in anatomy back in the day. And next to him, Dr. Levine, who was our AOA past president. And of course, President Phelps, and just a couple of us chumps, Brett DeGoyer and I, and Dr. Priscilla too, whom graduated and still get to see each other at conventions, which is a lot of fun. Stay involved, get into leadership roles, volunteer for committees. One of the first people I ended up remembering and meeting here at Kirksville was Jacob Curtis on the far right with his stethoscope on. He was like coming up to me and saying, and he was a year ahead of me, "You got to get involved with Family Medicine Club. You got to come in, and this is why it's so exciting and so important." And so he got me fired up, and I'm like, all right, family medicine. Like, yeah, I know I wanted to do family medicine. And then all these different other people came into the picture with just helping to build, that excitement and that passion, and to see that, you really make a difference out there when you're helping out with committees and working with the different people in the community. Dr. Steve Rubin, he's in the bottom right corner. He was actually, when I was ACOFP student president here, he was the doctor that we got to bring on campus, and he was a character. This guy takes care of The Sopranos. You remember that movie or that series? He takes care of them, and it's legit. He's serious about these mafia guys. So all these people are so fun. And yes, I do have a life, a few things I do, and I still make time for some karaoke. Make sure you give back to the students. So many people have invested in you and have put in the time to try to make you at your best and go out there and help people. Remember that when you get into practice. To really, take rotations and the students to come there. Keep in touch with your school. You'll learn when you're a couple years out, maybe even a few years out, how unique your experience here has been, and what a great family that this school is. And, everybody here, it's so great to visit. So make sure you take time with the school and keep in touch. There's people from my residency from Kirksville I went I did residency with, that I still see. And of course, my partner in crime, Priscilla, too. Every convention, she's calling me up saying, "Let's room together. Are you going? What are you doing? Here's what's going on." So you really build lifelong relationships here. Give thanks to your mentors. They helped you to get you where you are at today and where you will be in the future. Tons of appreciation. Always keep your family first. You're going to be busy. You're going to work long hours. You're going to be wanting to do the next cool thing. Maybe someone's calling you out and flying you out to X Games to help out. don't lose sight of your family. Remember that they're there to help you and support you, and make sure you give them time, even your dogs. And so I give my dogs a shout out at the bottom, Chamo and Slick. So what's my next adventure? I'm excited to have been elected to the President's Council on Fitness, Sports, and Nutrition Science Board, and that'll start in January. And I will be doing a 2-week internship at the Olympic Training Center in Colorado Springs, hopefully to go to the Olympics one day. Keep growing and learning. Never be afraid to take on new adventures. And that's my husband at the bottom being silly. We put gold foil on his teeth. But it's not about the money. It's really about helping people, working with a team, and just helping others to be at their best. Your adventure has started here at KCOM. You're already building greatness. And as a DO, you are unique, and you all have mad skills. It's about building the relationships, keeping those relationships, and passing it forward so that those that come after you can also know about the special traditions and relationships we have here at KCOM. So thank you very much for having me. I know it's cutting it close. And any questions, I'm going to be around all today and tomorrow for half a day. I'm happy to answer. So thank you so much for having me.